Feel free. Kia ora koutou katoa. Good morning. We've just come from a very useful meeting with a number of major New Zealand businesses and business representatives where we discussed the vaccine rollout in New Zealand and the work that we can do together to ensure our vaccination campaign is a success. As you all know, the vaccine is important for protecting our health, our economy, our current freedoms, and securing the gains that we've all collectively made to date. So there's a lot of support for ensuring that next stage of our measures around Covid-19 are a success. On that note, I have good news. This morning I can confirm that New Zealand's first batch of the Pfizer-BioNTech Covid-19 vaccine is set to arrive in New Zealand next week, well within our scheduled timeframe and ahead of previous expectations. That means we should be in a position, all things going to plan, to start vaccinating our border workers from next Saturday, the 20th of February. I can confirm that officials in New Zealand have been working tirelessly behind the scenes to secure the timely arrival of these vaccines. And there has been regular contact with Pfizer over the last few weeks, and I want to thank them for their work. I also want to acknowledge and thank Pfizer for not only ensuring the delivery of the first instalment, but doing so earlier than originally anticipated when we entered into some of those agreements. Last year we indicated the vaccine would arrive in Q2, and earlier this year we updated that to Q1. So given all the pressures on global distribution, it's very pleasing to be receiving them at this stage in the quarter. Minister Hipkins, Minister Wood, Minister Little and Dr Bloomfield are all here and available to answer any questions that you might have, but before we open up, I do want to speak quickly to the sequencing from here, just as a reminder. Our first priority is our border workers, our first line of defence, who interact with returnees who may potentially have the virus every day. We expect to vaccinate these approximately 12,000 workers within a 2 to 3 week time frame. The next group to be vaccinated will be our border workers' household contacts, their family members or people they live with, as they have the highest chance of picking up the virus from the border workers they live with. Following this group will be healthcare and essential workers and those most at risk from COVID, such as the elderly or those with medical conditions that make them vulnerable if they get COVID. These people will be vaccinated through, we expect, Q2. Before vaccination of the wider population starts, we anticipate in the second half of the year. As I've said many times before, this will be New Zealand's largest ever vaccination campaign. Never before have we vaccinated our team of 5 million in such a short space of time. It is going to take all year to reach everyone, so the sequence and ordering is important. But be assured, we have pre-purchased enough vaccines to cover all New Zealanders and to do so for free, and the Pacific as well. And we are so lucky that we can run this campaign in a fashion that means we continue to protect every New Zealander without the experience of those life and death situations that so many other countries are experiencing. We're now happy and ready to take questions.
Is it the full 450 doses that you're expecting in the first batch?
No. Minister Hipkins, would you like to talk to the sequencing?
No. Our advance purchase agreement has us getting around 250,000, just slightly under 250,000 in the first quarter. That is going to come in waves. So I've indicated previously that we're likely to get a near weekly delivery, and that our first quarter shipments will be split over those deliveries.
So how many will we get in that first week?
It's likely to be in the low tens of thousands that we would get in the first shipment.
And which day are they likely to arrive?
We're not in a position to be able to share that. We actually only take ownership of the vaccines once they arrive in our freezers and once they've been deposited in our freezers. Up to that point, it sits with Pfizer and with the company that they're using to transport them to New Zealand. And they have asked us not to share the specific information about how they're getting here or when they're getting here. We obviously have to respect that.
We understand that it will be by air. What can you tell us about the logistics of how they'll get from Pfizer to the arms of our
It's
border.
quite an exercise.
It is a significant exercise. Obviously, one of the key things for us is once they have been deposited in our freezers and we have taken ownership of them, we then have checks to do to make sure they've been kept at the right temperature all of the way through their journey, and that they are safe to use. And that'll take a couple of days to do that, which is why we have indicated that we're ready to go from Saturday, allowing us to, that couple of days. If they arrive earlier, then it just allows us a little bit more time to do that as well. But we need at least a couple of days to do all those checks, and that's why we've said we're confident from Saturday we're good to go, and so we're going to start preparing for that.
Minister, can you just clarify how many are arriving next week that we will start seeing roll out on Saturday? Are you saying it's tens of thousands that will go daily for some time or weekly?
Like I said, we're expecting the first shipment to be in the low tens of thousands, but over the coming weeks in the first quarter, we're expecting to receive, I think it's 226,000 by the end of March. Now they'll be split over several deliveries.
And when will the remaining 500,000?
So they'll be split over quarters 2 and 3 at this point. So our Pfizer delivery schedule has us receiving that 750,000 courses over the first 3 quarters of this year.
Keeping in mind it's 2 doses.
Yeah.
Yes. Will the first batch be enough to cover all of our border workers and their families?
It will certainly be enough to cover all of our border workers. I'm confident that we'll be able to cover their families in a timely manner. Bearing in mind, we're expecting to, once we start getting them, we're expecting to continue to get regular deliveries once we get underway.
And how many vaccines can our freezers hold?
I can't remember the exact number. We certainly have enough freezer space to hold the ones that we're expecting and the ones that we've already ordered, and we continue to look to expand that.
Can you just clarify, is that 226,000, is that doses or people, full courses?
That's courses that we're getting.
Okay.
Yeah.
And what does that look like in terms of distributing it from those freezers here and in the South Island? What's the plan around it?
So we have the bulk of our freezers are here in Auckland, and we also have freezers in Christchurch as well. So we will be sending some to Christchurch as soon as those freezers have been certified and ready to go. Once they come out of those freezers, they can be brought up to a higher temperature for up to 5 days. So that gives us the opportunity then to distribute. We would be looking at a quite tight distribution timetable though, so we wouldn't be sending out large numbers to the places that are going to be administering the vaccines. We'd be looking to send them out as they need them, so that we minimise as much as possible wastage.
But will it be going directly to MIQ facilities? Will there be designated doctors or clinics? What are the logistics of getting those workers?
So for our first rollout, which is obviously a reasonably controlled and smaller workforce, we'll have dedicated teams going in, as we do with testing, going and delivering those to the border workers in their workplace. That's the first part of the strategy. As we start to open up to a bigger group, for example their family members, we will be asking their family members to come to a particular location, and it won't necessarily be the workplace of their loved one, because in some cases we don't want extra people going to those workplaces like MIQ. We want to keep the minimum number of people in them that we can, but we'll be nominating a place where we'll be asking them, please bring your family to this place for their vaccine.
Just for context, so everyone is obviously aware that the freezers we're using are keeping their temperatures at below 70 degrees Celsius. For that 5-day period where you're able to bring it up, my recollection is it's 2 to 8 degrees,
yeah,
so
which
it's
is the
still
normal cold chain.
so it is still requiring that cold chain of supply, and we do need to make sure that we maintain that all the way through the process, just to give you a sense of the logistics.
And does each vaccine have to be broken down into 4 or 5 doses?
Yes,
And
yeah.
is there any particular training or anything going on?
Yes. Go ahead, Minister.
Thank you, and kia ora koutou. So, yes, there is some additional logistics around the administration of this vaccine, because it comes in vials that contain, which were initially 5, but now can have up to 6 doses. And there's a separate diluent that has to be added to that vial, mixed, and then the dose is drawn out very carefully. This is different from all our other existing vaccines. So all our vaccinators, even though they are trained, need to do a specific training module for this vaccine, which is actually a 2-hour online training module, and the first 100 of those vaccinators are already undertaking that training now.
Why is there the secrecy about the delivery of the vaccine?
Look, I'm not sure I would characterise it in that way, but ultimately we're able to give you a sense of when we expect generally that they'll arrive. The drug company themselves, though, they're still the ones responsible for its delivery into New Zealand. They want to keep that specific information around when precisely it's arriving and on which flight it will be arriving to themselves. And look, there'll be a number of reasons for that, not least, of course, there are a number of variables that they'll be having to manage. And so if they give too much specificity, of course, there's a question sometimes of whether those details might change. And I imagine there's an element of security around it as well.
What happens if someone refuses a vaccine, if a border worker or their family member refuses a vaccine?
Well, of course, at the moment, our messaging strongly to all New Zealanders is that this is a way that you can play your part to keep yourself, your family and your colleagues safe. No one understands that better than our border workers, so we're getting a strong sense that there's a real eagerness to protect themselves and their family members. I expect that therefore we'll have very good uptake. What we're working through with our team members and workers at the border is if they are reluctant or unwilling to be vaccinated, whether or not we need to consider where in the system they are working so we can minimise their risk.
They could lose their current job.
No, that is not what I'm saying. No, it's a question of whether or not they would remain in positions that put them at the front line and then put them in a risky position. Those are issues we're working through. I don't anticipate that being a large issue. These workers, they absolutely understand how important it is to keep themselves and their family members safe. We'll be doing as much as we can to support them in this early vaccination process, and I imagine we'll have good uptake.
What about those workers or their family members who are pregnant? At the moment, the advice is speak with their GPs.
Yeah, and look, you know, for a number of reasons, I imagine that those will be conversations that already would have happened around whether or not someone's working at the front line whilst pregnant, interacting with Covid-19. So I imagine often those conversations will have already been had prior to a vaccine becoming available. It is, of course, considered safe for those who are breastfeeding. For pregnant individuals, it is a conversation between those who they have a medical relationship with, their doctors and GPs.
Why would they need a conversation with their GP? Who would it be suitable for or not suitable for?
And that's actually, look, let me get Dr. Bloomfield to speak to that. The advice from MedSafe has been that it's not that they've not said, for instance, that pregnant women shouldn't have the vaccine, but they have essentially turned that over to medical professionals.
Thanks, Prime Minister. Yes, the key issue here is that none of the trials for this vaccine have included pregnant women, but as the PM said, the safety data doesn't suggest there'd be a risk for pregnant women, so with good information, some women may choose to be vaccinated, others may choose not to be.
What's the ongoing discussion with other pharmaceutical companies about giving the other vaccines here? Where are you?
Of course, within our advanced purchase arrangements, we have general indications around delivery timetables, and we've had nothing to suggest that any of those have changed. The next most important step, though, of course, is MedSafe approval for those additional vaccines. MedSafe are in the process of now receiving information that they need to start that process with AstraZeneca. But as I say, nothing otherwise to suggest those general quarterly timeframes have changed.
And how big a sort of event is this when it comes to keeping our country safe?
This is a really important milestone, but it's just that, one of many that we'll have over the course of this year. This will be a significant ongoing campaign, but there's no question that it's fantastic to reach a point where we can add that extra layer of safety for our frontline workers who do an incredible job on behalf of all of us. Okay.
Can I just ask a question about Air New Zealand, Minister?
Yep.
What's your view on Air New Zealand taking down their information so quickly on the gas turbine work they're doing?
Oh, look, that would be ultimately a question for them. You will have already heard my view on the work they were undertaking with contracts offshore for other military forces, and I maintain that view. Now, though, obviously agencies are looking into whether or not anything more formal in terms of our regulatory framework has been breached.
Do you trust the airline though to investigate itself?
Well, it's brought in, as I understand, PwC to undertake some work on their behalf, but actually we don't necessarily need to rely solely on that. There is already work being undertaken by government agencies as to whether or not Air New Zealand have upheld New Zealand's legal obligations.
Would you support the Green Party's calls for the Foreign Affairs Committee to investigate?
I personally wouldn't see that as necessary because the Ministry of Foreign Affairs and Trade are already looking into the issue in conjunction with Customs.
At the outcome of those investigations by NFAT and others, would the government then look at a higher level inquiry?
I don't want to necessarily preempt that because, you know, the outcome of that should answer a number of questions. And of course, keeping in mind, the Select Committee always has the ability to question, as they did last week, the leadership of Air New Zealand.
Did you see Anna Lorke's speech in the House, and what did you think of it?
I haven't seen it.
Has everyone spoken
I have,
to
of
her
course,
about
I was
it?
present for Anna Lorke's maiden speech, and as I understand, there has been the issue of a notice to the National Party for editing together speeches in such a way that leads to a misleading outcome, and so that's ultimately a decision for the Speaker in Parliament.
Has anyone spoken to her about it?
I couldn't answer that question necessarily at this stage. I certainly haven't. But do keep in mind that a ruling has been made that there has been editing that is being undertaken here that's led to a misleading outcome.
Just a question for Chris Hopkins about Air New Zealand aircrew returning
Yep.
from high-risk countries.
Yeah, go ahead.
Would you expect Air New Zealand to notify officials where those crew are staying?
Our officials have been working very closely with Air New Zealand around all of their arrangements for keeping their air crew safe. Obviously, we recognise, as Air New Zealand recognise, that those who are flying internationally are at greater risk of coming into contact with COVID-19. So we've been working very closely with them to constantly be refining what they're doing, including issues like exercise, making sure that these people are being well cared for. It's a tough job at the moment, and we need them to keep flying. So we're working really closely with them to make sure that they can keep flying and that we can keep them safe in the process.
So do you expect to know where they're staying?
We have been talking to them about where they are staying. We've also been talking to them about the extra protections that can be put in place in those places where they're staying, including things like putting exercise equipment into empty rooms so that they don't have to leave the hotels in order to exercise. They can stay in the same place.
Sorry, just to clarify, so you do expect to know where they are staying?
We've certainly been in conversations with them about where they are putting people up.
Minister, just with regards to the use of nebulizers in MIQ, we understand that the Ministry of Health is okay with it, but they have been linked to an outbreak in Melbourne, we understand. What's your thinking around that?
I'll ask the Director General to comment on that, but just overall, we're always looking at where the risk factors are in our MIQ facilities. We're always making changes. We will have more to say about the Pullman in particular in the next day or two, as we've been doing a very thorough investigation there around how we can improve that facility so that it can be reopened, and we'll have more information on that very, very shortly, indicating what changes are being made and when it will be reopening. But I'll ask the Director General to comment on nebulisers in particular.
Thanks, Minister. Yes, I talked with my Chief Science Advisor, Dr. Ian Town, on this just last night. The situation in Australia was an interesting one where the person didn't consider the use of the nebuliser as medical equipment and so was doing that in their room, and the people in charge of the facility weren't aware. Here we have, because of the way a nebuliser works, someone who would be needing and using a nebuliser would be being cared for in one of our quarantine facilities with a higher degree of clinical and health support anyway, and any staff or having interactions would be using the appropriate PPE like N95s, but we will be going and having a specific look at that issue again.
In terms of the vaccine rollout,
Yeah.
specific, because the vaccines coming ahead of time, are we looking at an earlier distribution push out in the Pacific? What would that distribution process look like?
Yeah, a good question. We're actually proactively having this discussion at the moment. One of the issues that we've been having to contend with is simply how do we overcome the distribution issues that Pfizer particularly presents. And as you've heard, specific equipment needed for transportation, very limited time frame, they can be outside of that equipment. And so these are things that we are actively working through. So we'll be looking to really have conversations with our counterparts in the Pacific around what might be possible with some of those trickier vaccines so that we can see similar levels of protection provided in the Pacific at the same time as we might be seeing that in New Zealand. Just one final note. Oh, you can have the last question, then I'll just do a wrap.
In terms of MIQ cleaners, is it fair that they're not getting paid any more than what they had been prior to those facilities being used as MIQ facilities, given they're now at great risk?
And look, I'm simply unfortunately not familiar with the contractual arrangements for those individual workers. But what I will say is I'm strongly of the view that those workers in particular need to be at the front of our queue for vaccines. We need to change the mindset in New Zealand about a workforce that is doing us a service. We need to demonstrate how important their job has been to us, and I'd like to see that kind of acknowledgement at all levels.
Sorry, Thomas, one quick question from an Australian colleague. What is the
That does not help your case.
She's a Kiwi.
vaccine rollout mean for the Trans-Tasman bubble?
Well, as it was reflected on a number of times, unfortunately we don't have enough data yet for vaccine having an impact necessarily at this stage on transmission. So we just can't say for sure that if you're vaccinated, you're not at risk of passing on COVID-19 to others. That will be a significant step change if we see that evidence and data emerge. And I'm sure that will make a difference for travel to all parts of the world. So at this stage, it won't necessarily make a difference there.
So it won't change the MIQ rules at all for people coming
Not at this stage, but we keep a very open mind as the research and the data continues to present itself. I did say I'd wrap. The Minister has a flight. The last final comment I want to make is that behind this program is an extraordinary amount of work that has gone in, particularly by the Ministry of Health. They have completed multiple walkthroughs now of what this initial vaccine rollout will look like, the logistics behind it, making sure that we have the technological platforms to deliver a year-long campaign. I want to acknowledge the long hours and hard work that's been put in alongside our ongoing regime around protections against COVID-19. So just my thanks to the team who've been working on it. Thanks, everyone.